And welcome to the Listen to the Legends, the third session by none other than Professor MKC Nnair, and it will be moderated by Dr. Samit Dalwai. West Bengal Academy of Pediatrics has started this gesture to show their regards and respect to the doyens in pediatrics. And this is the third episode we are going to organize. And this episode is coordinated by Professor Tipa Sindhu Chatterjee. I, on behalf of West Bengal Academy of Pediatrics, as the president of WAP 2025, welcome Sir and Dr. Samit Dalwai, and welcome all the audience who will be watching this episode. So, without wasting time, I'm giving screen to Dr. Kripashendu Chatterjee, who is the coordinator, and you worked hard for this. So, over to you, Professor Chatterjee.
Thank you, Sapanda. It's a great day for West Bengal Academy of Pediatrics, and we are really blessed with the presence of two doyens in their own field. MKC sir is needless to mention, so everybody are eager to listen from him. So I'll request another very important person who we like and very popular, Dr. Atanu Bhadro. I'll request Atanu sir to introduce Samit sir for the meeting.
Thank
Atanu
you.
sir, please.
Yep. Thank you, President Professor Shapon Rafe of WBAP and President-elect Kripashendu Chatterjee for coming out with this concept. We are having the third of the series. In fact, we had started almost 3 years ago. There was in between, there was a gap, but I think we are again back to the legends. And my job is to introduce a person who will definitely Dr. Samit Dalwai doesn't need any introduction in IIP platforms. Even in some other platforms also, he doesn't need any introduction. So a man with the concepts and who places it, as Professor Nnair said just before starting, he places the words, chooses the words in such a way that we can understand what he is trying to mean. For all of us, we have to look for words, but they come automatically and naturally to Dr. Samir Hussain Dalwai. So he's a we all know he has his concepts of neurodevelopmental system and neurodevelopmental science, neurodevelopment chapter, and in fact, everything is centered around him. And he was the joint secretary, treasurer of IIP, working for IIP for many years. So thank you, Samit, for getting out the time for being with sir. And welcome, Samit, to the platform. Please take it over from this point of time.
Thank you so much, Dr. Atunuda, our National Treasurer of Indian Academy of Pediatrics and my dear friend. Also, good evening, President Sir, Dr. Shopan Kumar, Dr. Kripashendu Da, as well as Dr. Sukanta Da, all the other doyens on the screen today. How does one introduce somebody who he considers as his guru father? How does one introduce a legend? How does one talk about a person who taught you how to speak? How does one talk about a person who is responsible for your profession and for professional growth? So it is not something that is possible to do it formally. So I spoke to sir and he was very happy. He said that Samir, you speak from your heart. And as always, even for this, his guidance is needed. As all of us know, the one and only Dr. MKC Nnair sir has been a phenomenal journey in the field of not just medicine, but the life of a pediatrician. He started his career as a pediatrician, as a neonatologist. Even today, when you go to Kerala and you speak to a pediatrician there, they will tell you that in the 80s, sir used to work the whole week in the CDC, the Child Development Center Trivandrum, which is synonymous with his name. But every weekend, he used to have his bag and the other bag of the kit for neurodevelopmental evaluation. And every weekend, he used to travel to one or the other part of Kerala for years after years after years till he trained each and every person in neonatal resuscitation. From there, his interest grew further into child development and developmental assessments. And then he did the same thing not only in Kerala, but all across the country. And he made CDC synonymous as a center of excellence even before the government ever recognized any centers as the place of pilgrimage, the place of knowledge in India, where if you had to learn developmental pediatrics, you had to go to CDC, Trivandrum, Thiruvananthapuram, and work under Dr. MKC Nnair sir's guidance. And if you were taken on as an apprentice, that was the luckiest thing in your life. And I can name n number of people today who are themselves topmost leaders in the field of development pediatrics, who have all been blessed by a journey under him. From there, sir started also working at the other side of pediatrics, that is adolescent care. And his work in adolescence is, all of you are familiar. Again, most of the people working in this field, even a senior person like our dear Dr. Tuteja sir, will say, I am blessed to be a student of Dr. MKC Nnair, though he is far older in age than even MKC Nnair sir. So sir basically was a professor emeritus in the developmental behavior adolescent pediatrics in the Child Development Center, which I mentioned. And his work was so immense that he was then named as the Vice Chancellor of Kerala University of Health Sciences. For 5 years, sir was completely focused on improving the quality of care of the Health Sciences University of Kerala. Thereafter, the other things that sir has always done for us, he had started the very famous PGD series, the postgraduate diploma series, whether it was for adolescents or whether it was for developmental neurology. And I was fortunate in 2006 to learn under him there officially. There are so many things that we can talk about, sir. Sir was a past president of the Indian Academy of Pediatrics. Sir has been the editor of so many books that I cannot even remember. Sir has contributed chapters. He is the editor now of the most popular Illingworth textbook of normal child and normal child development. And the most important thing is, sir, whose MKC is, M stands for magneticism, because he is like a magnet that attracts all the intellectual, all the hardworking, all the dedicated people from India. K stands for Karuna. It's not an English word, but it's very important because he has the compassion and the generosity to teach everybody who comes to him. He has never ever refused anybody. He has never discriminated on any grounds. Whoever wants to learn, sir will never say no. And C stands for charisma. This I don't need to say. You need to ask people all across the country, and that maybe in detail I can tell you some other time. But today we are blessed to have sir as a legend, and he is going to talk about one of his most favorite topics about adolescence and counseling. And it's over to sir for the next 1 hour. Ladies and gentlemen, hold your chair because you are going to get blown off your chair otherwise when you listen to the legend. It's over to Dr. MKC Nnair, my teacher.
Good evening, sir. Good evening to all the respected senior leaders, our listeners. West Bengal is special for me because my younger days, actually I have visited Bengal much more than any other place. And one reason for that is Dr. Dilip Mukherjee, who was, and the first time we did developmental pediatrics, actually it used to be in Ramakrishna Hospital. In the canteen, we'll get food. Sometimes sir used to bring from home. Till 10 or 11 people we started. Similarly, the adolescent started, of course, with, Dr. Swati Babi also in the picture. That's how the whole thing started. But my life didn't start here. Actually, I became a teacher in pediatrics on 1st of January 1977. So maybe next year, I'll be completing 50 years as a pediatric teacher. That will be a major milestone in my life. So 50 years as a pediatric teacher. So I just 2 minutes, I'll just tell the story. What happened was, I was interested in pediatrics. I was also interested in doing so many things, but I was not, actually I was interested in psychiatry. But then my family said at that time, psychiatry was not a sought after thing. I wanted to do dermatology, but there was no PG program there. I wanted to do community medicine, but again, somehow the department here was not that good at that time. Gynecology I want to do because I thought I'll do very well, but my tongue is very bad. So I myself decided, don't go for that. You can't be a gynecologist. So I like children. So that's how I landed up in pediatrics. Okay. And particularly after doing 3 months elective, then I started enjoying children. And during that time in CMC Ludhiana, that's the first part, 80 to 90 or 89, 10 years, I used to send children from the OP to the psychiatry where they were actually using half the floor. We were staying in the other half. So we used to discuss with the psychologists. Little time afternoon we get. That's how I started learning interest in child gardens. When I came to Trivandrum in SAT hospital, late Dr. Elsie Phillips said, you like child gardens, take it. We have a clinic which is not functioning. So I started on 14th of January 1980, the child guidance clinic, and now by now I have seen more than 75,000 families, children families with problems. And then when it started child development, because again, most of the children with behavior problem had either an intellectual problem or parents had too much expectation. That's how 87 August 1st Child Development Center started. 2014, in between, so many things happened with the University of Kerala. We had so many programs. And the only thing I feel proud in with me is that except 5 or 6 names, all the developmental pediatricians and all the adolescent pediatricians of top grade were my students. And now most of them are better than me. That's the best part of it. They are all better than me. That's the best part of it. And then I went to 2014, I went as Vice Chancellor, University. 5 years, I took a break from pediatrics, everything, because that was a very responsible job. So I didn't get involved in any of these things, which are its positive aspect, that has its some negative aspects also. And after 19 October, I retired from there and came back to a private hospital in a village area, rural area, and started the NIMS Child Development Research Center. So this is the story that made difference. Now, if you want to do counseling, you better have some training, not necessarily full do psychology and all, but some even distant education. I did this program after Annamalai, after I have done counseling for 10 years. Now, counseling has 2 words. Either when you suppose I say something, you can take it 2 ways. Affect pathway, feeling pathway. Why did sir say like that? You didn't like it. Or you can take a cognition pathway. Why did he say like that? There's some reason why he said. Maybe he wanted to correct me in something. This happens to all of us. With the teacher and student, always this happens. So there are 2 pathways, feeling pathway and cognitive pathway. Then if you do the child guidance, 3 people I have to remember because they were so good to me. One late Dr. Elsively was head of pediatrics. Then Dr. K.A. Kumar, who was chief of psychiatry at that time, and Dr. Hariharan, who was chief of physical medicine. These 2 people were so supportive of me that that's how I could do. You can imagine the politics in a hospital. When you want to do child guidance, nobody will agree with you. But these 2 people said, go to him. If he has a problem, he will refer. Then I will see. I won't see without him seeing. Both of them said. So much of physical medicine I could learn, so much of psychiatry I could learn because of these 2 people. And I must remember them because that's very important. Now, if you look at 1 year data, I'm just giving a typical year data. The problems are mostly scholastic backwardness. So if you want to look at any adolescent, you have to think of scholastic problem and you must know a little bit about it. There is a problem called conversion reaction or somatization. Conversion is something you have a tremendous psychological trauma, not a single trauma, then it becomes post-traumatic stress disorder, but you have something which you cannot take it. You start behaving with what do you call somatic symptoms. That is called conversion. For example, give an example, a child is not able to lift the upper limb. Neurologist said everything is okay, but he's not going to do. I just dialed the number of the father, which just like that, gave to him. He grabbed it. But remember, he grabbed it doesn't mean he is malingering. He actually has a problem. The only thing is, his problem do not have a physical cause. It has a psychological cause. But you must take it with respect. That's important. Then behavior problems, oppositional defiance, speech problem, whole lot of things. In fact, the previous thing, we were developing a what is called a checklist. The checklist that is available is child behavior checklist, which has 130 items, which is not possible. So we are trying to make a 30 point item where we can pick up all this. Now, scholastic backwardness, we all know that it may be because of intelligence. Okay, if you want a learning disability, you first have to rule out IQ problem. It should be minimum 70 at least before you can talk about, learning disability. It could be environmental problem in the home, school, or with friends. That all we know, we take lot. Then it may be a particular subject problem. He is not able to handle the subject or poor fit with the teacher. That's very important. But more than all this, think of it, 90% of scholastic problem I see, they have either anxiety or depression. The child will come. And now, if you ask me one more, it may be substance abuse also. This is very important. This is very, very, very important. Because all the time, medical students even, I had a case where actually he was out for 5 years, so principal refused to do anything for him. I pleaded with him saying that, sir, he was not a drug addict. He's only having depression, not identified, not treated. That's how he got into drug, because this can happen to your child, So he said, just allow him to come back. He will do well. He did well. In fact, that's the whole point. So this is important. And one person, the last word in India, I consider for child psychiatry is Paul Russell. So without taking his name, I won't give a talk, because he is so meticulous. Like mathematics, he will take psychiatry. And one lesson he taught me is that never go by the history alone. We all say take good history, good history. If you take my family history, there'll be 100 problems. But doesn't mean I have a family problem. Doesn't mean I have a psychiatric problem. All of us have so many problems. So what? But the point is, you may use that only for intervention. But first make a diagnosis. And Samir will agree with me, the biggest problem in developmental pediatrics is nobody make a diagnosis. Child comes with hyperactivity, you go on 2 years with that. Child has a speech problem, go on 2 years with speech therapy. Like that. But what is the diagnosis? After 2 years of therapy, you say it was autism spectrum disorder, and what they needed is developmental therapy, group therapy, and individual therapy. So remember, try to make a diagnosis, but when we plan intervention, get into the family history and all that, because for intervention that may be important, but not for diagnosis. Very important message. Then conversion, I have said it, so I won't say more. Actually, in the world literature, I have published the large number, 500 cases of conversion reaction. At one time, that was my passion. But the most important thing in child guidance you must realize is, in the first 5,000 cases I have seen, there were 87 cases which I proved it was not psychological, it was medical. Remember, take this message seriously. We have a very easy way out by saying that the fellow is not improving, not coming, this thing must be psychological, refer to psychologists. Now, the problem with psychologists, they only understand Freud and all that. They can only think like that. They don't understand medicine. I give 87 out of 5,000 cases. Just remember. So one case I will tell you, a fellow child was not walking. He won't put his foot down. But otherwise, okay, you can do anything with his leg, nothing will happen. I also didn't think there was a problem. But I said, without an X-ray, those days only X-ray was there. Without an epilateral X-ray of the leg, I won't touch the child. And guess what happened? It was a green stick fracture. Now, what is the problem? Green stick, a stick, when it goes like that, it doesn't have any, it is not separated, so there is no pain there. But when you put your foot down, the weight line goes through that crack, so he will have pain. Got a point? So this is important. Never make anything psychological. Even if you may, keep on thinking the other way. Could it be medical, which is miss out? Then feeling is the most important problem. The good part of our life is because of feeling. Okay. The bad part of our life also is because of feeling. Okay. If you go for honeymoon, it's because of feeling. If you get fed up and say, and sit with the webinar the whole night, that also is because of feeling. Got a message? At some age, you decide enough is enough. Now you keep on doing webinar. That is also lack of feeling. So that is what is important. People forget what you say. People forget what you do, but people will never forget how you made them feel. Okay? This is very important. Very, very important. Samir can, say anything to anybody, but nobody will feel bad because his politeness and language is like that. No wonder he will reach high positions. I'm sure he will reach high position because he has that talent to talk appropriately and the correct words without mincing words, systematically, but never say insulting word. That is very important to learn. Okay. Then, what is counseling? We all think counseling is different. What is counseling? We have 3 words there. One is advice. What is advice? Like suppose a 20-year-old child is coming to me, I'll be advising on love affair based on 50 years old my ideas. Now this is all gone. They don't relate to that. They don't relate. What are you talking? So I have to become like a 20-year-old, use their gestures, use their language, use their thing, and they get shocked. The moment you say, look, this is what happened. No. Then they will understand this chap is as worse than me. Suddenly they will come out with that. You get the point? You can't, advice is old. You start becoming old and then behave like. I'll give you an example. Yesterday, somebody wanted to do a professional trails. Yesterday, I was not able to do because after being vice chancellor, all my joking character has gone away. Now I can only be strict, stiff. So I can give messages, but I cannot, playful unless I am taking a class, but not in front of a video. So that's it, sir. We had done so many programs with you. What happened now? I said, what happened is because I have become older. I was holding a very high position. Now I cannot go back to childhood. Get the point? So this is important. What is counseling? You need to understand your client. You have to be non-judgmental. You have to keep confidentiality. How do you keep confidentiality? Tell the child from the beginning, I have been doing counseling for 45 years. I have seen so many children, but I will never, I have seen every bad thing in the world. So don't be afraid of telling me. I have heard it 100 times before you. But nothing will go to your parents or anybody except two things. One, if somebody is abusing you, then I have no choice but to tell your parents. Okay, legally I am bound to do that, particularly not abuse in the childhood or something. Happening repeatedly now, I have to tell. Secondly, if there is, you have a plan to do suicide. These two are must, otherwise nothing will happen. Then you have to be responsive and you have to be listening. The best example would be the adolescent girls will come, they don't come depressed. They'll be wearing very fashion dress and all that, sir, this, that, and all that. And you think they are very happy people. I enjoy with them for a few minutes, all that. Then say, better, that is okay. Then why are you crying inside? Eh? Why are you suffering so much inside? Suddenly she'll start crying. I know she is having depression. So what happens is the adolescents try to cover the depression by trying to behave normal. That's very important. What are the benefits of counseling? Most people think counseling is something big, psychiatry and all. Nothing. Counseling is more common sense with a background of some psychological principle. It's all common sense with, in fact, elders, teachers, all counsel. The only problem with them was, suppose you are a teacher for 40 years, then you start thinking big of yourself, so you can't do counseling. If you are a professor, you can't do it because of, but a counselor can go down to low level. Even otherwise, I'll tell you, most pediatrician, parents come into my room when I was, not now, when I was practicing, they'll say, why are you using a broken, chair? I said, it's not broken. I'm just put it down. Why? Because when I sit on that, the child face and my face should be equal level. I cannot be standing like this and look down on him. So the modern chairs, you can put it very low because it's on a pillar, na? So you can put it very low and they feel happy that this fellow is also my height only. Get the point? So that is a very important thing. Never look down on people. Try to understand them. In fact, most of the jokes, they will tell me, sir, how do you, I'll say, don't tell me anything. Isn't it this one, this one, this one, this one? When I tell, sir, how do you know all what happened in our bedroom? I said, don't ask me like that, but just tell me yes or no. So yes, sir. So that is what happened. Why that is important? Because if the parents have problem, the child will never improve unless you settle the problem of the parents. This is very, very important. Just yesterday also I had a couple. They are actually nurses, both of them. Okay. I just cracked few simple jokes like that, and suddenly I saw his reaction, and I called the girl this side. I asked her, what is happening? This thing, there is a problem. But then she is not willing to go for solution. Should I counsel there? No. Why no? Because she didn't come for that. You can't push your counseling on somebody, even if you know that it is positive, it will help. Never do counseling on a person who is not asking for it. So I said, can you come another day? You come another day, she won't come. She didn't come. Husband told me she won't come. So that is also important. Never push your counseling on somebody, especially the adolescent girls now, because they have very different feelings why you are doing all this. So don't do that. Okay. Now, the most maximum counseling I did as a vice chancellor, because we had a program called Student Support and Guidance Program in the university. So student counseling, educational counseling, vocational counseling, career counseling, placement counseling. It is called SSGP, Student Guidance and Support and Guidance Program. What we did is 324 colleges. From every college, we had a male and female teacher extensively trained in counseling. They have a unit there, simple unit, not a big place. A simple unit, children can go. Got a point? So out of 324 colleges, when I left the university, 285 colleges have very actively functioning unit. How do I know it's actively? Because every month I go to one district, call all these people, take a senior counselor also with me. I can't talk all the time. So I'll give introduction to the counselor. And what they will do is, we look at all, this is the person I'm talking about. This is called student support guided counseling. What is guided counseling? All these people are faculty, not student even, faculty. What the psychologist will do is, I will be sitting there, the psychologist will do is, one will act like a counselor, other one will act like a counselee or the person having problem. Okay? And the only principle to remember is, don't ask close-end questions. Just mark my word. When you do counseling, don't ask close-ended question. That means, did you do that? No. Then what will you answer? Yes or no. Then again you have to think of another question. It will not come out. You should look at the press people, media. What do they ask? Oh, when your mother died, how did you feel it? You may feel irritated by that question, but what it gives a whole lot of opportunity to talk about good and bad feelings. You get the point? That is called open-ended question. It should give a person the opportunity to talk more and more, not close it. And I'll show you the data later. Counseling for health-related purpose, it can be psychotherapeutic counseling that should be done by clinical psychologists or psychiatrists. Pediatrician cannot do psychotherapeutic counseling. Crisis counseling, yes, we all do it. Especially a baby is going to die, a newborn is in bad shape, we all do. Health counseling is called healthcare counseling. What is healthcare counseling? I'll talk about later. In fact, university has a department on that, and that is called everything. There is a biopsychosocial model. What does it mean? Biopsychosocial. If I have depression, I have a problem with the neurotransmitter. Any amount of philosophy won't solve my problem. I need to take drugs. That is one. If I have a problem with my thinking, it's called cognitive error. My thinking is bad, then that needs counseling. And then I need social support. I'll come back to it later. Okay? Genetic counseling, personal counseling, marriage counseling, very important. Motivational counseling. I'll tell you, I won't say who it is. One of the topmost officer of government of India, heading a big division. He came there, he was looking at all my tools, TDSE, LEST and all that. I said, sir, why waste your time on all this? There is only one tool that is good for you, useful to you. And that is called PASS, Partner Assessment Scale Trivandrum. Because you are at that stage of life where there could be problem. So he looked at it, then he took a copy of it, photograph of it. I'll talk about it later. So that is the thing. Now, then you have, I forgot to say, I thought that slide is there. In a year, in the university of 1.5 lakh students, we used to get about 950 students with a serious problem. And those 900 cases would have been missed if we didn't have SSGP program. You understand the importance of that? Easy to talk, but very difficult to establish something. So then now let us come to pediatricians area, counseling. Global development delay, intellectual developmental disorder. We don't call intellectual disability, intellectual developmental disorder, autism spectrum disorder, ADHD learning disorder, OLD, learning disability. Now, what management we do is developmental therapy. What is a development therapy? It contains 5 things. Actually, I'm writing an article on that. group therapy, okay, individual therapy. Then we do a individual education plan, a SOC analysis, strength, weakness, opportunities, and challenges of the parents. You may think both are working, they are IT. So there's a lot of money they can look after the child. No, that is positive, but also negative, because they are so busy they can't look after the child. Whereas a school teacher, both are school teachers or having some smaller job, they have all the time in the evening at least to look after the child. So that's how we decide what is the strength, weakness, and opportunity and challenges of the parents to look after particularly the autistic child. Then of course parental counseling, and our aim is to get the child to class 1 somehow. Whether it need not be at 6 years, it could be 7 or even 8, but child should go to class 1. That is the purpose of doing the therapy. Now, what is the practical steps in counseling? The very important thing. First, you have to have a positive relationship building. What do you mean by, how do you get a positive relationship building? Very difficult for most people, because you have already become middle-aged or even beyond that. You can't do playful with the children, but only if you playful with them, you can get a positive. And the classical case I will tell you, because this is one case in which I got 22 posts in the child development center. Okay, because a big man's daughter had problem and he was fed up of it. So when he came, he didn't know what to do. It was related to a love affair or something, but he was not against it. But the child was so difficult. So I looked at the girl, she looked at me. We spent 15 minutes staring at each other without any reaction. And I was doing like this, biting my nail, which is not there anyway. But I thought, after 15 minutes, children get fed up. We don't get fed up. Okay. So then she started, what she did is, she started looking at me very seriously. I also started looking at her. Then I told her, okay, big eyes, very big eyes, big round eyes. And there was some twitching here. You understand? I know that she enjoyed it. Then I just told her that boy also say like that, no? His girlfriend. Then she winked and said, that was a rapport building. But I'm not advising to do that in the OP. You can't do all this. You have to be very careful how you do it. And you have to have a lot of self-confidence to do all that. So your own way, you get a rapport building. And then let the child talk. That is called ventilation or catharsis. Ventilation means you keep on ventilating. Catharsis is, loose tool. Ayurveda treatment. For everything Ayurveda, they will give that one, no? Motion, go, maximum goes, you will be better, they will say. Then every person, we all have 100 problems. But we need to realize 3 out of it. And then prioritize the problem. 1, 2, 3. Don't attack all the 3. The most important you attack. And you look at the client's role in the problem. When we have a problem with somebody, we all blame on the other person. But actually, it's not other person. We also are responsible for that. Even IAP I have seen, people have problems with each other. Okay. And then what happens? We say, oh, he behaved to me like this. He did like that. He like that. Just ask him. Just remember what all good things he has done for you. You understand what I'm saying? I am sure if he had done 3 bad things for you, he might have done 6 good things. Why don't you remember that also? So enmity will not grow. He also have a, mood changes. You also may have a mood changes. So think of the other, especially husband-wife issues. Don't ever put the blame on the other person. The moment you blame the other person, you have already lost the game. Even if you are getting bad reaction from the other side, then you must, say in a way that I know why you behave like that. I must have been, hurting you. I must have said something like that. I must have picked on that. So take some blame on yourself so the other person feel happy. Then context of the problem. This is very important. You are coming, if you are a topmost gynecologist in the town and your girl, only one daughter, husband is not there, not your problem. But if you are a poor lady with 5 or 6 girls, children, even if he's beating you up, you have no choice. You can talk in public, women's liberation, all that, you can talk. But in the house, poor lady, what will she do? She has no choice. If she doesn't listen to him, the children may go hungry, which is something which she cannot take. So context is extremely, even law take that into consideration, Before they give the verdict, they also take the context, also take into consideration. And solution, who should give the solution? Who has the problem should only say the solution. If I have a problem, only I know my context, I only know what solution. But you don't know the clear solution. So you will say 1, 2, 3 and help him or her to find out the best out of that. Okay? Then help implement the solution and terminate the counseling. Don't keep on going more than 6 or 7 sessions. You terminate the counseling. Okay, now the medical aspect. Now, how do you find, most people think we have not been taught psychiatry in pediatrics, so we don't know this. You don't have to be a psychiatrist because the sort of problems you see are simple problems like anxiety, depression, etc., which any of you can treat. There's no problem. So what you should know, simple things. That is, 3 rules: symptoms out of proportion to cause. I may feel bad, I may feel sad, I may feel angry, all that is because I am alive. But if it is consisting, persisting, and there's no reason whatsoever, then I must think, do I have a bigger problem? Okay? Without reason or out of proportion to reason. Then I have definite body symptoms. Okay? And because the body symptoms are so bad, I try to avoid routine activities. The teacher can't teach, student can't learn, wife can't do the thing in the home. Okay? I'll go a little more detail later. Then, of course, many mental state, I think I take long time. I won't do it. Okay. Now, there are some adult type of disorders also you may see. Anxiety disorder, which may be generalized anxiety, means anxiety 24 hours. You sit anxiety, you sleep anxiety, wake up anxiety, everywhere anxiety. You may have phobia. What is phobia? Phobia is not excess fear. Very important. Phobia is not excess fear. Very important. Fear may be big or small, but phobia is when there is an autonomic symptoms. The moment you have it, otherwise poor cockroach, so harmless creature. Why do people jump around? Even big film stars jump around because there is a cockroach. It is because seeing the cockroach, some sort of reaction come in there, and that you can't tolerate the reaction. Then you have panic attack. Most of the time, what is panic attack? I am sitting here, suddenly I start having tension, go to a peak. I think I am going to have a heart attack. Okay, I may go to casualty. They will do echo, ECG, everything. Everything is okay. Recently, it happened to one of my relatives. After everything was done, I went there. Then I told sir, everything has been done, nothing there. I said, but you also have a psychiatrist here, no? Eh? For what, sir? Just call him. And he came within 5 minutes. He said, it's a panic attack. Don't worry. It has nothing to do with the heart. The problem with panic attack, it will subside by itself. But you have the lingering fear. Will it happen again? So you are miserable. Then, of course, you have OCD, obsessive compulsive disorder. Have you heard of this? Yes. What is obsessive compulsive disorder? The classical take, I'll tell you. I do a lot of premarital counseling. So one girl came 2 weeks after marriage. I want to talk. I said, bring the mother. My rule is that without mother, you won't talk to a girl. But she insisted, let the husband come. I said, okay, let him come. What is the problem? Is he a bad boy? No, he's a good boy. But there is a problem. What is the problem? If he touch me, he will go and take bath. And how many hours? 1 hour he will take bath. Okay, how much soap? Half a soap he will finish. Am I such a dirty female that he has to take bath because he touched me? Touch me means have some sexual thing. Okay, I just told her that this is OCD. Sir, do you need medicine? I said, you can manage without medicine also. Then she said, okay, let him take bath. What is my problem? You understood? So OCD is something lifelong. It cannot be treated easily. Otherwise, you have to keep on going like so. Critical situations, you can give medicine. Some people try to give quick result by risperidone. Okay, but it's not good. It's not approved. The reason being, it will actually create person only temporary relief. It will come back again. OCD has many features which are like an obsession that won't go away. Then post-traumatic stress disorder. What is post-traumatic? My own one student had. She met with an accident. They were going to go into a ditch, but somehow it just stops by something. Miracle, something stopped. But she had some problem in the rib. Okay, MRI done, everything normal, but she is not convinced. Actually, she was brought here. The treatment was given by my mother-in-law and wife. Wife gave her a pessary, which is very pain relief. And mother-in-law gave her, she is my student only. So mother-in-law gave her some ointment, which she said is very good, I have been using. So that sort of counseling, it went away. That's all. So post-traumatic stress disorder, when you say, even after 1 year after the death of your husband, if you cry, don't say she is so affectionate for him, she is having post-traumatic stress disorder. This is an important message. You can cry for 41 days, you can cry for 3 months, some may cry for 6 months, but if you don't stop crying and get on with your work, you are not being affectionate, you are having post-traumatic stress disorder, and you need fluoxetine. Same drug for anxiety. This is important. We should not forget. Then depression, of course. Again, fortunately, depression and anxiety come together. If you have depression, then you have a tendency for suicide. If you have anxiety, then also you have a tendency for suicide. The drug is same, fluoxetine, 20 milligram for depression, 40 milligram for anxiety. Higher dose for anxiety. That's all what you have to remember. Substance abuse, I'll show later. Okay. Then you may have this, I'll skip it because it will take long time. Cognitive error is very important. What is a cognitive error? You know, our thinking is affected. That's why you call it cognitive behavior therapy. What is the problem? There are many things. The most important is overgeneralization. Somebody just made a comment, you didn't have a bath today? My God. Then you will start thinking, see, even he doesn't, who told me I didn't have a bath, that means I am not looking good. That means I am not little dirty. That means that means so many things. He just said as a courtesy call. Something he said, but you are putting on that. Overgeneralizing. Okay. Second is minimizing your positive and maximizing your negative. There are plenty of them. Arbitrary inference, whatnot. But just remember three things: overgeneralization, minimization of positive, maximization of negative. So this is a thing. Selective abstraction. So many things you would have said about me, but I will pick up. Actually, he said so many things about me. But if I have depression, I will pick up one out of it and say that was negative. And I will get focus on that. You understood? Samir introduced me with so many good words, but out of which I can always do a selective abstraction of something which can be bad or taken as bad. I mean, enough. That is enough. Then I have depression. Personalization. Everything happening around you, take it happens to you. It is your. He was trying to insult you. He was trying to only me. He was saying not for. He must have made a general comment, but you won't take it as general comment. You will take it as personal. Magnification, I said, then minimization, I said, arbitrary inference, drawing conclusion without any evidence. Okay, my teacher doesn't like me. Tell me one reason why you say your teacher doesn't. That all I don't know, but I know he doesn't like me. That is arbitrary inference. Okay. Then CBT triad, cognitive triad is negative views about yourself, negative views about the world, and negative views about the future. If you have all negative views, okay, then you are gone case. You will have depression. This is a cognitive triad. Negative views about yourself, negative views about the world, negative views about the future. You will have problem. You will have three problems. What are the three problems? The typical triad of depression, that you have, you don't feel good about yourself. You don't see any future for you, worthlessness, hopelessness, and helpless. Three words you remember. If just ask three things. You feel worthless, that means depression. You feel hopeless, I have no future. Again. Third one, helplessness. I can't do anything. I can't. That is why a severe depression person will not commit suicide. But a mild depression may commit suicide. Why? A severe depression, if he want to commit suicide, he will think, oh, I have to climb the table. I have to put a stool on top of it. I have to climb and tie the rope. Oh my, I can't do it. For him, it is like climbing Everest. So he won't do it. But when you give medicine, what happens? The psychomotor retardation goes down, but the depression doesn't come down. So he has energy, so he will go and commit suicide. So remember, again, pearl word is very important. When you are treating, you must warn the parents that Be careful. Keep a watch on him, because when his energy level increases, he may try to commit suicide. Okay. Rational emotive therapy is same thing, but instead of focusing on the cognition or thinking, it focus on emotion. Okay. This is called ABC. Actual event. You have a belief system and there's a consequence. Okay. Same event can happen to so many. I simple way I'll tell you. When the exam is over, your whole friends are MBBS exam. One fellow who got the highest mark, he will be crying because he lost 1 mark. Okay. The fellow who just managed to pass, he will be celebrating. The fellow who failed also is celebrating. Why is celebrating? Nothing new. Last time also I failed. What is so great about it? You get the point. So that is the actual event, but it depends on your belief system. This I have seen in surgery exams. The candidate who fail MS is always the best candidate. Why? Because he is so worried that some unwanted things may be asked to me and I will fail. So he won't perform well. Whereas the fellow who is so used to failing, whatever it is, he will bang. In fact, I remember one case in which they were talking of hip replacement. What are the complications? This fellow said a half a dozen complications. The examiner from All India Institute asked, where is given which book? Sir, I only made this complication. How many you have done? I have done 40. How can you say I have made this complication? How can you say no? So that's also important. There's a new method is dialectical behavior therapy. It's little similar to CBT, but it's difficult, so I won't go into that. Little bit about substance abuse. How do you identify a child with substance abuse in the house? Because the whole of India now, this program is going on as, the whole India is getting rotten because of people pushing drug into India with a systematic manner to spoil the young generation. So what is happened? The teacher should identify the children who is having irritability, anxiety, suicidal ideation. Teachers should find out. Let's not talk into the politics of all that. That's not our job. Teachers or doctors should identify a child who is having the substance abuse or use or abuse. And how do we find about? We should find by inattention of the child, irritability, anxiety, and suicidal ideation. Now, this is another most important thing. Abuse prevention. Okay. Now, everybody in India, they say that abuse is so common, so common, so common. Some Government of India document also say 80% girls get abused, 90% get abused. It's not true. Complete 3 districts, we did a big study and we found 10% of girls and 5% of boys were sexually abused. All the rest is not abuse. He must have said something, he must have touched like this. Hey, you teach the children, forget it, man. What I tell them is, the bed bug, bed bug. I tell these girls, bed bug, they'll come and bite you in the unwanted places. Okay? And do you get angry with you and go with the AK-47? You don't go because bed bug is useless. Most of the small things you forget. Don't try to take it hard because there's a whole lot of people who survive on abuse. They want to hike up the abuse. Okay? It is like, once my social justice secretary called me and said, what is the prevalence of learning disability? I said, is it for getting money or giving money? What do you say like that? If you have to get money from Government of India, it's 30%. But if you had to give money to patient, it's 3%. You understand the thing? If you are getting money, hike it up. But otherwise, give 3. Now, this I made this saying that I don't believe that it is the police or judge who can save a child. The child can be saved primarily by the child, empowering the adolescent. Then their parents, then their teachers, then the health workers, then the religious heads, and only the small part can be taken care of by the police. Because what does police do? They only make life miserable for you. They are supposed to do it. It's a law. You can't blame them. But the fact is, a child is, every time she is telling all this, however much friendly you say the POSCO Act is, still the child literally suffer forever. So that is important. So the pediatrician asks, suppose a mild case, should we report this and all? My answer is, if you are scared of a legal thing, you report. But if you are not scared of legal so much, protection of the child, you may not unless it is a recurring one. Recurring one you should show. I'm not telling this as rule. Preeti will say it's nonsense what I said. I know all that. But as a practicing pediatrician, a father and a grandfather, I will say, if possible, don't try to make ruckus of it, because what happens? It makes the whole life miserable for the child. But if it is chance of recurring, then 100% you have to inform child life. Now, what is healthcare counseling? Biopsychosocial model. I said it for depression. The biology part is neurotransmitter, you need fluoxetine. The psychology part is cognitive error, so you need counseling. And the social part is this one. This I'll tell you one simple example. There was a girl who actually got everything done. In the end, they came one day regressing whole thing. I said, what is the problem? Father wants her to wear the red skirt and she wants a green skirt. What to do? So things are so simple. So I told him, beautiful, just let her do what she wants. Why do you want to create a rift and problem with the child? No. Why can't she wear this one? Not like that. If the parent is not supportive, if the friends are not supportive, if the teacher is not supportive, depression cannot be treated. Now there is something called self-counseling. This is actually not from any other place. It's my own life. All this life I have gone through all problems by doing self-counseling. What is self-counseling? Do not bluff to yourself, may have to bluff to others. You understand? You may have a great opinion about me, but only one person in this world know me. Who will be that? Tell me. Who?
Your wife.
Wife. Okay. I always tell the girls, mother would be giving you the best picture of the father, but she only know what this fellow is like. That is very important. You are not God, so you're likely to take mistake. So may take precaution. Precaution. If you're counseling an adolescent girl, what you should do? This is a very important message I'm giving. You must ask her to open the curtain, not you. Because if she has opened it, then she'll remember, yes, he insisted that you open all the curtains. You understand my point? But the glass is there, so nothing can be heard outside. And just outside the curtain, glass sitting there comfortably. She can see what is happening inside. She cannot hear. This is the safest way in the modern world to do counseling. Don't do it in a completely closed place, because you never know how these girls can behave. Then don't think others have to like you always. Have self-love. Everybody may not like you all the time. Don't insist all IAPN should like me. Is it possible? No, simply not possible. Caring and not love. You should be caring for your family and wife, not love. Morning love, afternoon love, evening love, every time love. It's not required, because they will perceive it. And I have a technique for that. I had never said a positive thing to my wife in my life. But wherever I give a talk, I always will talk about her. And something will filter from there and reach her here. And ladies enjoy that better. If you tell I love you, they don't like it. But when somebody come and tell you, oh, he was talking very high of you, see, that's one small word may be very good for. So remember, don't do that. Refuse to take insult. Be always happy. But what does that mean? You don't. Somebody abuse me. I don't take insult. Why? Because you are not worth it. Why should I take? If I take abuse, insult seriously, then I am suffering for nothing. Why should I? And after 30 seconds, initially you may feel little bad. Then you must go for what? Cognitive thinking pathway. What did he say? He said something which I didn't like. So what? But there was some point in what he said. If you have that habit of 30 seconds, you keep quiet, don't abuse back, don't do anything, just keep quiet, smile at the face. The fellow will wonder why I am abusing him and he is sitting and smiling. Okay? What happened? This I have seen there. In the parliament also I have seen, where Atal Bihari Vajpayee was there. There was an RJD, MP who is abusing like anything. And I was wondering how Prime Minister can sit through. And the way he will look, Vajpayee ji will look he will look like, very good. Here, get along, go. See, because he is so small, he has sat with Panditji, Nehru also. You understand my point? So once you are a little more older and all, don't take all this serious. Think of other person's point of view. Be a third party. Just somebody, if your child come and say something, don't say, I don't want to hear anything. You are bad. Don't have that one. Even the Supreme Court judge will not say you are bad. They will take many days before they write an opinion whether you are correct or wrong. Whereas parents and teachers on the spot decide you are bad. Don't do that. Do not hurt someone if possible. Do not hurt yourself ever. Okay, morning when we get up, we are thinking what to do, how to give, put a spike into this fellow. Don't do that. It doesn't do any good for you. Okay, and don't hurt yourself ever, particularly for girls. They should not, just because the boy will go away, don't give him anything. It's not worth it. And they may threaten you, I will commit suicide. Good. Anyway, you will do it tomorrow for something else. Might as well do it today. Finish it up. Okay. I am the custodian of my mind, body, and spirit. I will protect, preserve, and enhance it. Means I am the custodian. Tell the girls, you are the custodian of your God gave you the body, God gave you the mind, God gave you. Don't give it away to anybody. That is very important. One more thing and I'll stop it. I think it's too much. Two more things. I'll just quickly do it and stop it. 10 commandments for pre-conception counseling, which is become family life education for adolescents, immunization for school children, rubella, hepatitis B, HPV, pre-conceptional folic acid, not after you're pregnant, much before that, body image, dental care, very important, medical checkup, ultrasound of the abdomen, very important, screening for menstrual problem, PCOS screening, screening for anxiety, depression, and suicidal ideation, some amount of sexuality skills, understanding the needs of self and partner. This is very, very important. You may be highly educated with triple PhD, but you don't understand your husband's need, or the husband may not understand your need. So that has to be told. Newlywed counseling, both partners, most important is honeymoon urethritis. And the girl will never come and tell you. So I do a lot of premarital counseling. What I do is slip of paper. I'll write albumin sugar deposit, say keep it in a purse. If you have some urinary symptoms after marriage, then just give it to a boy, give him 10 rupees extra for chocolate. He'll go running and bring back the result. If the pulse is more than 6, call me, I'll give you mocks or something. Okay. Self-counseling for coping skills. Last one. Till now, what we said is for other people. Now, this is for you. It's called partner assessment scale. Just see whether you are happy in your marriage. That's all. In reality, with all the good and bad, overall rating of your marriage. Above 50 happy, below 50 happy. That's all you say. Second one, fantasy. Whether your wife fit in with the fantasy, or the child or the profession fit in with your fantasy. Most often it may not fit in. So what? If the reality is good, fantasy doesn't matter. But if reality is not good, then you go for further and further fantasy because you need to satisfy yourself. Support is financial support of the family, in-laws, peers, friends, professionals, etc. Attitude, whether taking the marriage, concept of marriage seriously or not. Sexuality, sexual satisfaction with partner. It is not a score. This is not a cricket or something you have to have so many score. No. Score is not important. Are you happy or not? That's the most important. And if you are not happy, that reason is the husband may be a taking type and not a giving type. Giving type means you will do anything in the world to make her happy. The school students, you say happy. College students, you will say, pleasure. And if it is married, you will say ecstasy, what you call, the more higher words you can use. Okay. And last, of course, spirituality. If you and your wife share the same values, similar values, then you will be the happiest couple on earth. And the last one is one more, human relations. Be generous, love conquers all, love without expectation, love yourself and love everyone. Focus on love, compassion, and devotion. It is not for Hindus alone. It's a universal thing. If I don't respect your God, okay, then I am not a believer. I'll tell you this, what happened. I gave some sweets from the temple. Some girls, my girls, they refused to eat it. I didn't say anything. I said, okay, if you don't want to eat, don't eat. That same day, we went to a place and the priest was giving the inauguration and he did a praying for 15 minutes. Imagine 15 minutes listening to that. And those 15 minutes, I sat like this, like you will sit in a church. Then they were surprised. Then I said, I am a believer. So I respect God in whatever name you said. Doesn't matter. You understand why? If I don't respect God in your name, then I am not respecting God in my name. Because God cannot be multiple God. One for this one for that one for neighbor. You can't have 100 gods. Okay? It's all same thing. So why don't do it? Love yourself and love everyone. Focus on love, compassion, and devotion. This is the ultimate happiness in life. Thank you. Thank you very much. This is the last slide. Thank you.
I think if you were physically here, we would have liked to give you a standing ovation, sir. Focus on love, compassion, and devotion. I think these are the most wonderful words that we could have ever heard. Sir, you can stop the screen share so we can see you better.
Okay, okay. Okay.
I think the whole concept of listening to the legends is because you will hear what you can never read in any book, what you can never see on any video, but what makes you feel when that person speaks. And that's exactly what Sir said. People will forget what you say, people will forget what you do, but people will never forget what you make, how you make them feel. And I think when listening to Sir personally, when he talks with the kind of examples he gives, it's basically how you feel while being a part of this conversation that you will take away with you. But such wonderful advice, what a wonderful thing Sir said, that history may tell you the intervention, but only history cannot tell you the diagnosis. The other important part, sir, I'm going to remember is always rule out a physical disorder before you think of conversion. But even after that, keep on thinking, because you never know, a physical problem may come back again. And finally, like what you said, it's that don't advise, but be a part of that person's journey. And I'm reminded of a share by Ghalib, and Pukhraj Bafna Saab is also there. So I'll take your permission to say that ये कहाँ की दोस्ती है, ये कहाँ की दोस्ती है कि बने हैं दोस्त ना से, कोई चारा साज होता, कोई गम गुसाज होता. Where he says that it is not friendship. If
You
you
didn't
just
say
sit
wow,
like-
wow, wow. You have to say that. Yeah? Nobody said that. You have to say wow, wow. Then only the chair becomes interesting. Okay.
So it means that I don't need friends who come and give me advice. I need a friend who can just sit with me and spend time with me and listen to what I have to say. So I think this is what Sir has explained to us. And Sir has demonstrated this kind of counseling with us all the time, whenever since we have known him, either as students or as colleagues in IIP. And Sir, thank you so much for a wonderful, wonderful, wonderful deliberation today. I keep the floor open for all the other stalwarts who may like to share their comments today. With your permission, I open the floor for everybody else. Swapanda, you can take over.
Sir, we are really delighted to have you on this listen to the Legend Start sessions, and I think we are really lucky to have you, sir, in this session. So thank you very much. And what Dr. Samit Dalwai has said, yes, it's a very good learning, not written in book, but you have expressed from your core of the heart, and that touched us. Thank you, sir. Thank you, sir.
We are so influenced by it, there are no questions as usual. It's almost, today we had an oration basically. It was not a talk, it was an oration.
If anybody wants to ask or tell anything, so
Make a comment.
open.
Not ask question. You can at least make a comment.
The people started putting in the chat box. Excellent talk. Thank you very much, sir.
I think it's getting late also, probably.
Dr. Bafna sir, we have
Bafna is there?
Dr. Bafna sir with us. Yes, yes. So we have, so Dr.
I'm proud to say he was my first student for adolescent. Before the course started, he was there for 10 days, from morning 8 o'clock till evening 8 o'clock with 2 coffee break. Basically,
Dr. Bafna sir, can you kindly unmute yourself, sir? So unmute kar dijiye. Unmute yourself. Just a few
Take
comments.
team. Please now unmute all. Take team.
Ah,
Please unmute all.
समीर भाई
जी sir.
Yes, sir, you are audible. Yeah, you are audible, sir.
बड़े कामयाब वो अहबाब हैं जो दिल से मिलते हैं और मोहब्बतदार कुछ आसान नहीं, मुश्किल से मिलते हैं।
क्या बात है।
MKC नैर उनमें से एक है और दूसरे आप हैं, इसलिए बहुत बढ़िया। So kind of you, excellent talk. वैसे भी MKC Nnair is our guru so far as this message is concerned, but a good friend of ours. And जब वो adolescent की बात करते हैं, तो adolescent भी खुश होते हैं. Not only the people who care for adolescents, but the adolescents also, they are so happy to listen to him. So thank you very much. Excellent talk. Wonderful. Just wonderful.
Yes, sir. He's not the guru, he's the Mahaguru.
So you remember the 10 days, morning 8 to evening 8,
Yeah.
the training program.
I remember.
Thank you so much. Dr. Sukanta ji, any comments from you? Dr. Jalil bhai, Dr. Ashim, sir, Dr. Champakda.
I still learning point from MKC, and I was listening, and I have taken screenshot of all the presentation of yours so that I can read it subsequently also. It's really learning point still today for me. Thank you very much.
Thank you, Samir bhai. I should pray the Almighty to give a long life to MKC Nnair sir. We will have very often lectures like this, very motivational lectures, and my prayers for him. Thank you so much.
Amen to that. Absolutely. Fantastic. Ashim da?
Yeah, Samir bhai, can I come in?
Yeah, Ashim da.
You know what, this is something you should listen to. As you very rightly said, you don't find this in textbooks. Sir has given examples just like this. And it's so very easy to understand what he's trying to say. So it's just out of this world talk. Thank you so much, sir. Thank you.
So maybe we can close it then.
Yes, sir. Yes, sir. There is one question, sir, if you permit me.
Something else?
MKC sir. Samir bhai, 2 lines about MKC.
Yes, sir. Irshad.
मोहब्बत के ये माने हैं किसी पर कोई शैदा हो. मतलब मोहब्बत तब होती है जब कोई किसी पर मरे. मोहब्बत के ये माने हैं किसी पर कोई शैदा हो, और जहां आशिक नजर डाले वहां माशूक पैदा हो. MKC Nnair is a person, जहां जहां नजर डाले वहां माशूक पैदा हो सकती है.
जहां भी जाती हूँ वहीं चले आते हो, चोरी चोरी मेरे दिल में समाते हो. So, sir, there's a last question for you. The doctor, how can we effectively counsel adolescents who present with internalizing symptoms like anxiety and depression, but are resistant to verbalizing their emotions due to cultural stigma or family dynamics?
You have to perceive their problem. That's what I was trying to say. Child may be, dancing around and come to you, but you should look into the eyes. And in fact, this I said, when I was doing in Baroda, I remember 30 years ago, 35 years ago, adolescents started. There were a dozen, pediatrician coming with me. We went to about 8 or 10 schools. Every school we are doing a different style of, talking family life education. So I think it was Swadiji who asked me, how do you feel? Why are you saying things so openly? How do you feel, confident about it? I said, simple, madam. Just look into the eyes of the child sitting in front of you. See the reflection of your own child or grandchild. Whatever you say will be perfect. That's very important. You need to look into the eyes of the child. But sometimes this does create problem also. Because, see, when you look into a child, all the time you can't look into the child. So I look like this outside. And then they will turn back what is happening behind. Actually, it's nothing like that. Sometimes you have to do that because you can't keep on staring at the child. But look into the eyes of the child, you will understand the whole turmoil inside. And that needs little expertise. That's all.
Thank you so much, sir. And Dr. Kripa, Dr. Swapanda, if you have any comments, otherwise I'd like to thank everybody else who's on this platform. And sir ko bilkul mantra mugdh hokar sabhi sun rahe the. Everybody was mesmerized. So I would like to thank everybody else. And it's back again to Kripa Da and Swapanda. Thank you so much for giving me this great honor and privilege of attending this session by my Guru, Dr. MKC Nnair. Thank you, sir.
Thank you, Samit bhai. It's really a pleasure to have you and your Guru Shishya. It It means the student and the guru all together. MKC sir and you, West Bengal Academy of Pediatrics is really thankful to you. And I am also thankful to all the faculties that have joined in this faculty link and who have joined in the audience link also. So in the next 10th April, we are going to organize our 4th session. So it will be said by Dr. Bashindu Chatterjee, then we will stop this session. Kripa?
Sir, only one point I can make it from here. It's not academic. I never thought the people of the stature of MKC sir would respond to my first phone call when Swapanda told me, can you do this thing? I was under a lot of pressure. So I called MKC sir, and to my surprise, what I did find is that sir picked up my call and said, yes, I can do it. Just tell me the date and send me the message. So the amount of work and amount of this commitment sir is having and responding to just a common pediatrician like me, it's amazing. And all my regards to you, sir. The way you presented, I learned a lot. I was listening glued to your speech. Maybe I'd feel myself fortunate if I can put at least 1% of this into my practice. Thank you, sir. Thank you so much.
So we are calling it a day. Good night, everybody. Sir,
Good night.
yeah.
Good night.
Good night. Good night.
Good night, everyone. Good night.
Good night, everybody.
Good night.
Kripada, bye bye. Thank you.
Yes, sir. Bye. Thank you. Thank you.